Okay, good afternoon, everyone, and thank you for being here today. As you're all aware, the Office of the Chief Public Health Officer announced 3 presumptive cases today. 1 case in Inuvik and 2 cases in Yellowknife. When the pandemic began, we made quick decisions about how we were going to protect our residents and our communities from a possible outbreak. We declared a public health emergency, we restricted travel, we required self-isolation planning, and we put restrictions on businesses and people as our first cases of COVID-19 were confirmed. We stood up contact centers like Protect NWT and 811, placed border staff at airports and highways and enforcement officers across our regions, and we established safe space for isolation in communities with enhanced medical care. The health and safety of residents and communities was and is our biggest priority, and those decisions paid off. Our communities were kept safe from COVID-19, and we've experienced no loss of life. The second wave that was anticipated by health officials across Canada in the early days of the pandemic is here. Southern Canada is seeing record levels of cases, and it was inevitable that we would eventually see new cases in the Northwest Territories. What I want to say is this: the measures we put in place at the beginning of the pandemic are only going to be effective if everyone does their part. It's critical for residents and communities to remain as diligent as possible, more than ever before. The government of the Northwest Territories is committed to protecting everyone. I know that the measures we have in place have been difficult for people, but it's important to remember we're all in this together. We must all look out for each other and take care of those around us. Northerners are resilient, and when faced with difficult challenges, we've always been able to find a way to persevere. I'm confident that we will continue to adapt to this pandemic to ensure that we're protecting the health and safety of residents and communities. Please stay safe, listen to the Chief Public Health Officer's recommendations, and stay positive. Thank you. On that, I'm going to turn the mic over to Minister Green. Thank you again, everyone, and thank you for helping to spread the message to residents. Oops. Minister Green.
Good afternoon, everyone. First, I'd like to acknowledge that those residents who received presumptive positive COVID-19 tests are now recovering with close monitoring from public health. And of course, our thoughts are with them. This is a very frightening diagnosis. We recognize, of course, as the Premier just said, that we're not immune to COVID-19 in the NWT, especially given the surge in cases in Southern Canada. That's why we've worked hard in the past several months to build capacity to manage the risk and to be as responsive as possible when we have positive cases. Our work to build testing and contact tracing capacity means we are able to get results faster and begin investigations quickly and efficiently, and that's been the case this time. Our health care system has a solid plan to respond to positive cases in all communities across the NWT. We're ready to respond to cases if and when they arrive. We know that our fundamental public health measures minimize the risk of outbreaks, and we believe our system is responding and keeping communities safe. It's worth remembering that now, unlike April when the first case was announced, we know a lot more about the virus. We know what precautions work, and it comes down to basics, which we've stressed for months and which we never tire of continuing to stress. First of all, physical distance of 6 feet between you and the person who is near you. Keep crowds small and spaces large. That will keep everyone safer. Wash your hands frequently with soap and water or with hand sanitizer, and self-isolate when required. It is the single most important thing you can do to prevent outbreaks and to break the chain of transmission in the event that you are contagious. We need to remain vigilant in our efforts to keep residents as safe as possible. It's important to remember that we won't be risk-free until there are widely available treatments or vaccines. I want to encourage all of you to do your part as we continue to see this challenge and rise to it as we have over the last 7 months. And I would now like to call on the Deputy Chief Public Health Officer, Dr. Andy Delli-Pizzi, to present his remarks. Thank you.
Thank you, Premier Cochrane, and thank you, Minister Green. So good afternoon, everyone. I'd like to begin with an update on the presumptive tests received by 2 people in Yellowknife. Both individuals are part of the same household. One person traveled while the other did not. The individual who had traveled isolated. It's quite common for household members of those with COVID-19 to develop COVID-19 themselves. Preventing household transmission can be difficult because sometimes we need to care for other people in our homes with COVID-19. So unfortunately, the individual who traveled still contracted COVID-19. There are some contacts that we're reaching out to provide the advice they need. We do need to provide public notification of 2 locations because we identified some exposure risk. So if you were at Anytime Fitness in Yellowknife on October 12th between 3 and 4:30 p.m. or at the RCMP Yellowknife Detachment public waiting area between 11 a.m. and 11:30 a.m. on October 13th, you must self-isolate at home for the next 14 days from the time of exposure and contact Yellowknife Public Health Unit at 867-767-9120. Those you live with must also self-isolate for 14 days if you cannot safely self-isolate at home away from them. During this period, anyone self-isolating must monitor themselves for symptoms closely. If you develop any of the following symptoms, no matter how mild, we are asking you to contact the Yellowknife Public Health Unit to be assessed. Fever, new or worsening cough, shortness of breath, malaise, muscle aches, fatigue, sore throat, runny nose, headache, diarrhea, vomiting, loss of sense of smell or taste, loss of appetite. If you are experiencing shortness of breath, please call 911 and let them know that you may have had an exposure to COVID-19. I'd like to stress that a public notice is not abnormal. We provide these notices not because we believe there's a high risk, but because there is some risk, and we'd like to mitigate that risk. We are ready to test those who develop symptoms quickly and provide the right advice. We've expanded our drive-through testing hours in Yellowknife this weekend from 12 to 4 p.m. Saturday and Sunday. If you do not have symptoms, you do not need to get tested. Isolating at home will keep you and others safe. So in some of NWT's previous COVID-19 contact investigations, there were as many as 70 contacts in the Northwest Territories. This was before our travel restrictions and isolation protocols were implemented. We have shown we are ready to manage these events during this pandemic. By moving quickly, we can minimize the risk of an outbreak. We will take every necessary step once again, and I want to assure residents across our territory that today we are safe. The presumptive test we received in Inuvik has been thoroughly investigated. There is no exposure risk to any communities along the route traveled. These 3 presumptive tests have been sent to our partner public health lab in Alberta for confirmation. This is required because the new devices, which have decreased our turnaround times, have been validated for negative tests, but have not been validated for positive tests. This is simply because there have not been many positive tests in Northwest Territories. But as far as public health, it is not material because we treat any presumptive positive test as though it has been confirmed. We will update the public when we have received confirmatory results. We are hoping they are back by Saturday. I know many are wondering whether this will mean a change in our public health orders or whether we are considering transitioning to an earlier phase. Our best judgment is that this situation is manageable, and there's no need to alter our overarching approach at this time. We'll continue to monitor the situation and update if there are changes. And I want to finish by echoing Minister Green's comments. While prioritizing physical distancing, wearing a mask when it's tough, hand washing, keeping crowds small and spaces large, and sticking to isolation when required may not be exciting, they are fundamental steps to keeping each other safe. So let's all do our part to protect each other as we weather this pandemic together. Thank you.
Thank you to our speakers. I'll now open up the floor for questions. As I said, I'll call on each of you individually. Please limit your questions to 1. If we have time after, I'll make my way back to the list. So we'll start this afternoon with Charlotte from the EPA.
any changes to self-isolation plans and the approach because of these cases?
Yeah. So self-isolation plan approach, we are clearly seeing an increased risk of importation to the Northwest Territories. We're seeing increased numbers of cases in southern provinces. We know we've had an outbreak in a mine in Inuvik. So we've always had an exemption process. We will always continue to monitor the situation, and if the risk continues to increase, we might reevaluate the exemption process and just and consider you know, the essentialness of work, and consider any other risk management activities that we can implement.
Sarah, CBC, let's start it over to you.
Oh, hi. I just wondered if you could comment on these people while they were traveling. Were they taking precautions, and is it safe for other people to be traveling now?
So we, what we do whenever somebody has a positive COVID test, we do a 14-day exposure history. So we'll look at every positive test, and we'll talk to people, and we'll see where they were, if they attended gatherings, and we'll try to determine where they may have acquired COVID-19. So we are in the process of doing that. And so but for the most part, we know that Northwest Territory residents are following advice, and we know that the public health measures we have in place and the self-isolation plans are protecting NWT.
Cecile Lafayette.
I was wondering, how do you do the investigation, like how it's going, and how do you find out all the people that the case is
So how do we find all the contacts? Yeah. So we have a, initially when we receive a positive result, we do like to contact the individual as soon as possible, immediately, and just ensure that they're feeling well, ensure that they don't need medical care at that time, and if they do, we direct them to medical care. We advise them to safely self-isolate at that point. And then we'll ask them to start to recall like where they've been in the last 14 days, and especially we review their symptom onset date, because the symptom onset date anchors their communicable period. And we will go over, our public health team will review in great detail where people have been during their communicable period. So that's the basis of how we start our contact investigations.
When asking your questions, if you guys do need to pull down, you don't feel free to do that, just to make sure your questions are nice and clear for our three spokespeople up here. So we'll turn it over, Emily Cabaret.
Yeah, I know the press release said the two Yellowknife cases, the test just came in yesterday. For the Inuvik case, they came back on the 10th. Were they tested as well, or were they late tested? I'm just curious.
So the test result from Inuvik came back yesterday as well. The individuals arrived in NWT on October 10th, like you say, and they were tested when they thought it was appropriate to get tested. I wouldn't give too much more information, but they sought testing when they felt they needed to. Yeah.
Mario, how do you
talking about the contacts, you said that some contacts will be reached out to. Do you have any more details on that? Like, how much people will get called or have to talk to you guys?
Yes, so we've identified a small number of contacts in one of the people who have the new positive diagnosis, and we have done a public. The public notification for the two locations that were indicated in this communication, and we will also post that information on our public health advisory on the government's webpage. So that's how we're reaching out to any other contacts that we haven't identified.
welcome back to Luke, CTLB.
Yeah, so you said that there's potential of exposure in Anytime Fitness. What's going to happen to the gym? Are the employees going to be required to self-isolate? Is it being closed down? What's going to happen there?
So we know that the risk is not very high, but it's also not negligible. We are advising that anyone who is in the gym at those specific hours contact public health for further advice and to self-isolate as if they were contacts. We are being extra precautionary, so that would include employees who are in the gym. Typically, there's no need to shut down a facility based on this. The virus, the COVID virus is transmitted predominantly by respiratory droplets, and we know that transmission through indirect means by touching surfaces and things like that is possible, but not highly likely.
All right, and Trevor and NSL.
What progress has there been on with regards to testing numbers, like the rate of testing in light of this, in light of these 3 cases?
So in general, the rate of testing in NWT has increased significantly in the past number of weeks. The regional health authorities have done wonderful work to acquire new testing instruments, and our capacity in NWT is in the range of hundreds of tests per week at this time, and we hope that it increases again in the coming weeks. In light of our new diagnoses, we have expanded hours as communicated in this communication, so the drive through testing in Yellowknife, for instance, will be open, and we would post the hours on our website for people who are interested. Yeah.
All right, nice and efficient. I like it. So we've got a couple more minutes. I'll kind of make my way back through, and then we'll see where that lands for time. So I know Mario, you said you had another question.
Well, yeah, I don't think you answered my question. Like, we know how much you're actively going to approach the people with contacts, and maybe to that, and like how do you decide on how active you are in reaching out to people?
So we will talk to people who have COVID-19. We will determine if they have been close to other people, and in that situation, we'll determine if others meet the criteria that we have for being a contact. In that situation, we will try to reach those people, and we will reach all those people. In these 3 individuals, we know that there are, in general, a few contacts that we've identified at this point. We are continuing the contact investigation, and for the exposures that we discussed at Anytime Fitness or at the RCMP detachment, we feel it's best to communicate in this manner and also through our government website.
Sarah, Adam, do you have a question?
Sure. So, I mean, you guys are testing wastewater to try and pick up COVID before you do the test results. Did that happen in this case? And if not, why was that not reflected in this case?
So we're still in the process of implementing our wastewater surveillance. We are working closely with Municipal and Community Affairs. They've ordered these auto samplers that have to be attached in line to sewage systems, and they're in the process of being implemented now. So currently we're just actually doing some grab samples in Hay River and Yellowknife, and we have not detected any positive through the wastewater surveillance. So we did not detect these cases with our wastewater surveillance. It hasn't been fully implemented yet.
Luke, you got a question?
Yeah. Are we able to get any details on the symptoms, the people who tested positive or facing?
You know, sometimes we like to protect that information because it's private information. We know that sometimes people are tested for mild symptoms, and sometimes people have more severe symptoms, but I would probably leave it at that if that's okay.
But there's no hospitalization though, or anything?
There's no hospitalization at this point, and we would notify the public if somebody had a severe COVID course.
Charlotte, did you have another question for Cecile? Okay. Cecile, Leon, do you have another? CBC, sir?
I have a question. It's a bit of a broad question, but I just wonder if you mentioned there may be a point where we reevaluate the exemptions. Is there a number there? Is there a number of cases, or is there a significant event that would trigger some sort of reevaluation?
We're trying our best to characterize the risk, and we can attempt to come up with a threshold, but it's very difficult because even the numbers we're seeing today from southern provinces probably reflect the situation from 1 or 2 weeks ago because of the time delay in diagnosis and posting the results. So we're trying our best that way, and I think most of it is just understanding the risk as best we can, and it's difficult to quantify. There are models that attempt to determine the risk of importation, and our modeling team here has been working closely with Public Health Agency of Canada to try to develop something like that, but there are limitations.
And Trevor, in NSL, do you have a question?
You mentioned some information about testing. What about the rural communities, if anything comes up in these areas, other than the highway?
Yeah. So our rural communities, testing is available in our communities with health centers. The tests have to be sent to other locations, but we are finding with the increased testing capacity in NWT that the turnaround test time has really been improved even for our small communities. So there is testing capacity in small communities, and right now we don't identify any additional risk to small communities at all.
Would that delay impact anything in those communities if cases did come up?
We do want to have test results as soon as possible, because a positive test we act quickly on. We advise the person to isolate. So if there are long delays, that could impact our public health response.
All right, and we're going to end it there. I'd like to thank all of you for coming and asking those questions. Always very important to have our leaders here to provide statements and answer those important questions for you. As usual, if you've got any follow-up questions, please just contact me after. I'll stick around for a little while, or you can email presssecretary@gov.nt.ca, and we'll get your questions answered as soon as possible. So thank you again to Premier Cochrane, Minister of Health and Social Services, and our Deputy Chief Public Health Officer.